Then we're going to go to a patho-PEC. But before we do that, let's talk about our goals of our PEC. I taught you with your left AIC that we want to get those individuals more alternating. They've got to be able to get from right stance to left stance. With your PEC pattern patients, you're going to have to get them more reciprocal first before you get them alternating. So if they're going into flexion with their inlet bilaterally, they've got to learn how to extend. If they're going into abduction, they've got to learn how to adduct. If they're going into external rotation, they've got to learn how to internally rotate. In the outlet, if they're in adduction and extension and adduction and internal rotation, they've got to learn how to flex, externally rotate, and abduct. They've got to do opposite. So you got to get reciprocal before you get alternating. Here's your circles of what we talked about. So we got to make our offs go on and our ons go off. So think about this, you guys. You guys want to do stuff that's going to help to do a posterior pelvic tilt. These are people that are stuck in an anterior pelvic tilt. They've got to learn how to do opposite. And if I turn on my adductors by putting a ball between their knees, which I know some of you have seen in some of our exercises, and if I adduct my femurs, what's my outlet going to do? Abduct. So now I've taken it from being here, and I put a ball between their knees, and I kind of turn on their adductors. I'm going to make them come here. And once I teach them how to do this, then I can make them more what? Alternating. And do I want to teach them how to do left stance, you guys, or right stance? Thank you. Because underneath every PEC is a left what? AIC. Every patient starts off being a left AIC pattern patient first. So your algorithm of treatment is going to be going to get them more reciprocal, and then they've got to get alternating and learn how to get into left stance, and then we've got to get them alternating back and forth. If my inlet is going into flexion, and I want to help to teach remember I had you guys underline this earlier. I'm looking at you, Christy, because you asked me about it. What muscle do I want to emphasize with my PECs? If I want to get more of left inlet extension, IOs and TAs. Because my IOs and TAs, remember, attach more distally, and they're going to help to pull my pelvis what? Back. So I've got to turn on my IOs and TAs in a sagittal plane to help to extend my inlet. Because if I extend my inlet, I'm going to flex my outlet. And if we don't inhibit the anterior inlet by using abs, you're going to have patients that can't shift or get into left stance without extending a what? Back. They've got to be able to close this down. They've got to have abs. And I think we do a good job, you guys, of teaching our patients how to blow up balloons and pull ribs down. But I don't know if we're getting the piece of helping to pull our pelvis back with inlet extension. I'll give you tips on how to do that with treatment. Inhibiting an anterior inlet is where I've made mistakes with my patients. And I told you I'm a clinician first. I want you guys to learn from my mistakes so you guys could get from point A to point B quicker than I did. I want you guys to learn from me. So I'm not up here saying I'm the best PRI therapist. I am not. I've made many mistakes, and I want you guys to learn from them. And this is where I've missed the boat. I progressed too quickly through this. Once you get them to get more reciprocal, you want to get alternating. So you want to go back to all the stuff that we reviewed before. You want to turn on a right rectus femoris sartorius. You want to turn on a left iliacus via glute med. You want to turn on a left anterior outlet via a left adductor and a left ischiopubo externally rotated position of your outlet. And you want to turn on a glute max. That's all the stuff that we've talked about right here. Once you get them into right AIC or left stance, then you've got to get them alternating. Left leg, right leg. Left leg, right leg. So you're going to understand our outline of our treatment tomorrow. Any questions with the PEC or goals?